everyone. Welcome to today's Thursday live section. I am so happy you're here with me today. If you're just joining us right now, I want you to drop your name in the comment section. Tell me where you're coming from, your location. Are you in Abuja? Are you in Lagos or Nasarawa? Or even outside Nigeria? Just let me see. Just want to see you in the comments because I always want to know who is here with me. So before we get into today's topic, I just want to take a moment to appreciate every single one of you just to spend your time here today, learning, growing, and being part of a community that genuinely cares about health and well-being. And that means so much to me. So thank you so much. My name is Loretta Ngwebesi Bill, and if you've been following this channel, you already know that every Thursday at 3 p.m. we come here to talk about real health topics in a real way. Um, no big grammar, no confusing medical language, just honest, plain, and useful information that you can take away and use in your life and your community. And today we have a very important topic. We're talking about Lassa fever. Now I already know some of you just say, that's the title, there's something like it's a general, it's something that we all know, and like it's not the disease that we don't talk about every year in the news and then everybody forgets about it. Yes, that's one, and that's the reason we keep going back to it because it keeps coming back and it has not gone anywhere. And so many people are still dying from something that can be prevented. So today we are going to talk about everything you need to know about Lassa fever. What is it? How it spreads and what the signs are. What the signs are and how to prevent it. What to do if you suspect or you see someone near you that has it, and that is why this conversation matters beyond just knowing facts. We are going to make this practical. We are going to make it real, and I want you to be so informed by the end of today, and that you can sit down with your family and then teach them what you learned here. Okay, so before we dive in, I I want to get the energy going in here. So if you're watching right now, I want you to type in the comments. Have you heard of Lassa fever before? Just type yes or no, no judgment. Because this is no wrong answer. I just want to know where we are starting from. So um, why why we are doing that? Let me say, if you're watching this and you know someone who needs to hear this today, please share this live video right now. Share to your WhatsApp groups, share to your Instagram story, tag someone in the comments, because the more people who are here today, the more lives the conversation can touch. So please share. Let me also say this, some of you might know someone who has been affected by Lassa fever, maybe in your community, maybe in your family. And if that is you, I want you to know that this section is for you too. So we are going to talk about this with the seriousness and the sensitivity it deserves. Now, what is Lassa fever? So I'm going to start from the very beginning. What exactly is Lassa fever? How it came about. So I'm going to discuss that right now. Now, Lassa fever is a viral hemorrhagic fever. Now, I'm going to break it down, into simple language so that we all can understand. A viral hemorrhagic fever is a type of illness caused by a virus, not a bacteria. So not a bacteria, not a parasite, but a virus, and that's it's that's in a severe form that can affect the body's ability to control bleeding. So the word hemorrhagic comes from the word hemorrhagic, which means bleeding. So in serious cases, Lassa fever can cause bleeding in different parts of the body. But I want to be careful here not to jump ahead because not every case gets to that point. So we'll talk about that in detail when we get you know where we get to the symptoms. Now, where did Lassa fever came from and how did it get its name. So that's what we're going to talk about now. Okay, now this disease was first identified in 1969. There was a nurse. Sorry, for I was having a network issue. So, like I said, this disease was identified in 1969. There was a nurse, a missionary nurse. She was working in a small town called Lassa in Borno State, Nigeria. Her name was Laura Wine. She became very ill with a severe fever that did not respond to normal treatment. So she was transferred to another hospital where two other nurses also became ill and died. So scientists investigated what had happened and discovered it was a brand new virus that they had never seen before. So they named it the Lassa virus after the town where the first case was identified. So Lassa fever started right here in Nigeria, and Nigeria to this day remains one of the countries most affected by Lassa fever in the world. Now, the Lassa fever started, the Lassa fever, virus, it belongs to a family of viruses called arenaviruses, and so these are group of viruses that are carried by rodents, specifically rats. Yes, rats, and can be passed to humans. So there are similar diseases in other parts of the world caused by the same family of viruses, but Lassa fever is the one that most affects West Africa. Now, Lassa fever is what doctors and scientists call an endemic, endemic disease in West Africa. Endemic means that it is constantly present in that region. It does not come and go like an outbreak that starts and then finishes. It is always there in certain areas, at certain levels. Countries that are most infected include Nigeria, Sierra Leone, Liberia, and Guinea. But cases have also been reported in other West African countries, and even in travelers who have visited West Africa and then gone back to their home countries in Europe or North America. But in Nigeria specifically, Lassa fever cases are reported every year. Like every year, the Nigeria Center for you know for disease control, the NCDC, put out regular situation reports on Lassa fever, cases across the country, and some years are worse than others, but it never disappears. Certain states tend to report more cases than others. States like Edo, Ondo, Ebonyi, Bauchi, and Taraba, yes, have historically reported high numbers, but cases have been found across multiple states. Now, here's something very important, that I want you to understand from the stats. Lassa fever is caused by rats. Yes, I want you all to know this. Lassa fever is caused by a rat, like a specific rat, actually. A specific rat, actually. And the scientific name is Mastomys natalensis. But most people just call it the multi-mammate rat. It is common rat found across sub-Saharan Africa. It is the kind of rat that lives in and around our homes, in fields, in foodstuffs, and it um, is a natural reservoir, of the Lassa virus, meaning the virus lives in this rat without making the rat sick. And so the rat carries the virus, shared it in its urine and droppings, and goes on living its normal life, as in its normal rat life. But if a human comes into contact with the rat's urine or droppings, that is where the problem starts. So Lassa fever is fundamentally a disease that starts with rats. And this means that controlling rats, removing them from your living spaces and our food storage is one of the most powerful things that we can do to fight Lassa fever. So we'll come back to this in the prevention section. Now, let me also mention the scale of this disease, because I think numbers helps us to understand the seriousness of what we are dealing with. It is estimated that between 100,000 and 300,000 people are infected with Lassa fever every year in West Africa. Like, you can imagine that, and about 5,000 people die from it every year. Like, you can imagine 5,000 people die from Lassa fever, like rats, Lassa fever. And the context of outbreak situations, and so the numbers can spike much higher, and these are not small numbers. So this represents real families, real communities, and real people. And one more thing I also want to say before we move on: Lassa fever is classified by the World Health Organization as a priority pathogen. So that means it is on their list of diseases that pose the greatest risk to global public health, and for which there is an urgent need, for better research, diagnosis, and treatment. So it sits on the same list as Ebola and Marburg virus, that tells you how seriousness the global health community takes this disease. Now, I'm going to list out how Lassa fever spreads. Okay, now some of you be wondering, okay, how does it spread? Like, how did it happen? How does people get how how do people get infected? Now, I'm going to list out the ways that Lassa fever actually spread, because understanding this is the key to protecting yourself. Now, there are two main ways Lassa fever spreads, and the first is from rats to humans, and then the second is from humans to humans. Like I said, the first is from rats to humans, and the second is from humans to humans. Now, I'm going to break both of these down properly. Now, from rats to humans, as I explained, the mastomys rats, the multimammate rat, it carries the Lassa virus in its body, and the rat shed the virus into its urine, its droppings, and then its saliva. So this happens continuously throughout the rat's life, and the rat does not get sick from the virus. It just carried it and then shared it. So and shared it. So how human come into contact with this virus in several ways. The most common way is through food. Yeah, you see some people, they cook, they don't even cover their food properly, and then they go back there to eat it. And especially when you're living in an environment that's there are rats everywhere. I've seen places I've gone to. Like, I remember the time I visited someone else, and if you see how rats, like, they were both doing competition. Like, so like it was so I was so surprised. I'm like, wow, these people are even living like where rats are staying, and they are not even scared. They're just like, it's just normal to them, and they are eating right there. So it's very, very dangerous. So when rats moves around our homes, especially our kitchen, our food stuff, our grain bags, they urinate and defecate on food items. So if we then eat that food without properly washing and cooking it, we can ingest this virus. And this is probably the most common route of Lassa fever infection, and it is why food hygiene and food storage are so, so critical. And that is why if you go to the market to buy food stuff, maybe carrot, fruit, vegetable, always use salt to wash it, because you don't know where it came out from, to prevent sicknesses like this or diseases like this. So we just need to be very, very careful. Now, think about this practically. You have a bag of rice or garri or beans stored in your kitchen or store, and then a rat gets in it at night, runs across the food, urinate on it, and then it leaves. And in the morning, you do not notice anything. You cook and you eat that food, and then you have just potentially been exposed to the Lassa virus. And this is not an exaggerated scenario. This is what happens in homes and in homes across affected communities every day, like every single day. And so the second way rats spread of virus to humans is through direct contact. So if you touch a rat or a live one, either live or a dead one, with bare hands, and especially like if the rat's urine or blood comes into contact with a cut or break in your skin, or with your eyes, your nose, or your mouth, you can become infected. So this also applies to people who handle rats for food. Like in some communities in West Africa, rats are caught and eaten as a source of protein. Handling and preparing an infected rat can expose a person to the virus. And the third way is through breathing in contaminated particles. So when rat droppings dry out, they can become dusty particles in the air. So if you are in an environment where there are a lot of rat droppings and you stir them up, perhaps while sweeping a dirty room, cleaning out a storage area, or working in a field, you can breathe in those particles and the virus can enter through your respiratory system. So and this is called aerosol transmission. So this is why when we talk about prevention, we will specifically say do not drive, sweep a room you suspect rat as that suspect as rat dropping. So use a wet mop instead, because dry sweeping stirs those particles into the air where you can breathe them in. Now I'm going to talk about from human to human how some can get infected. Now the second route of transmission is from one infected person to another, and this happens less commonly than rat to human transmission because it is very real and it is what makes Lassa fever dangerous in healthcare settings. Now, Lassa fever spreads from person to person through direct contact with the blood, with blood, urine, feces, vomit, sweat, or other bodily fluids of an infected person. So if you're caring for someone who is sick, okay, so like I said, Lassa fever spreads from person to person through direct contact with blood, urine, feces, vomit, sweat, or other bodily fluids of an infected person. So if you're caring for someone who is sick with Lassa fever and you come into direct contact with their bodily fluids without proper protection, you have like you can become infected. So this is what happened in 1969 with those nurses in Lassa. So they were caring for a sick patient and then they did not know it was Lassa fever at that time. So they had no protective equipment and they became infected. So this is why healthcare workers, are at particular risks during Lassa fever outbreaks. And they did not, Lassa fever um, outbreak. So that is why we need to be very, very careful, especially with the health equipment. It's good to cover yourself, you prevent yourself from getting infected. So um, um, now I also want to be very clear about what does not spread, Lassa fever, because there is often a lot of fear and misinformation around infectious diseases. Lassa fever does not spread through casual contact. You cannot get Lassa fever from being in the same room as someone who has it, from shaking their hands, from breathing the same air as them at a normal distance. So it is not airborne the way COVID-19 or TB is airborne. It requires direct contact with infected bodily fluids. So this is very important to understand, because fear and misinformation cause people to abandon sick family, like sick family members, friends, loved ones, to refuse to take patients to the hospital, to shun survivors, and all of those behaviors cost lives. So if someone in your community is suspected of having Lassa fever, they need to get to a hospital as quickly as possible, and that is what will save them. Now, let me also mention about sexual transmission. And the Lassa virus has been found in semen of male survivors for up to 3 months after recovery. And this means that a man who has recovered from Lassa fever can still transmit the virus through unprotected sexual contact during that period. And this is why male survivors they are advised to either abstain from sex or use condoms for at least 3 months after recovery. Now I'm going to list out the signs and symptoms of Lassa fever. Okay, some will be like, okay, what are the signs and symptoms? So right now I'm going to list them out. Now I want you to type something in your comment section. If you're learning something new today, type the word save in the comments. That is SAVE. Type the word save in the comments. Let me see you and let me know where you're watching from. Now, the incubation period of Lassa fever is between 6 and 21 days. And that means from the time you are exposed to the virus to the time you start feeling sick can be anywhere from 6 to 21 days. So even if you were exposed 3 weeks ago, you might only be feeling it now. So here's something very important to know upfront. About 80% of people who get infected with Lassa fever have mild or no symptoms. Like 80%, yeah. And that means out of every 10 people infected, about 8 of them will have symptoms so mild that they might not even realize they have Lassa fever. They might think it is just a regular fever or flu and recover without any treatment or diagnosis. But the remaining 20% develop more severe disease, and in those severe cases, Lassa fever can be fatal. And so the case fatality rate, meaning the percentage of diagnosed cases that result in death, ranges from 1% in the general population in about 15 to 20% in hospitalized patients. So this is because the people who end up in the hospital are usually the ones with severe diseases. Now, so let us talk about how the disease typically progresses. In the first week of illness, Lassa fever also starts gradually. It does not always come on suddenly like malaria fever. No, the early signs are very general and easy to mistake for many other ailments like malaria, typhoid, fever. But this is actually one of the most dangerous things about Lassa fever. Like I said, it's early symptoms. Like I said earlier, it looks like malaria, typhoid, flu, and many other common infections. So people often do not suspect Lassa fever at all. Like at first. So the early symptoms include fever. I'm listing out the early symptoms of Lassa fever. Then we have fever, a persistent fever that does not go away. you see some people always having fever, like you take drugs and drugs but does not go away. So that is the kind of fever I'm talking about. And then general weakness and fatigue, feeling very tired and weak for no obvious reason, headache, usually a dull, persistent headache, yes, sore throat. Some people experience significant throat pain in early Lassa fever, muscle pain, general body aches and pains, chest pain. You see some people they complain of having a chest pain. Some people report a feeling of discomfort or tightness in the chest, even in the early stages. You have nausea, feeling like you want to vomit, vomiting, and some people do actually vomit. Yes, we have diarrhea, loose stools or stomach upset and cough. Some people develop a dry cough. Now I'm going to pause here for a moment because I know you're looking at that list and thinking that sounds like almost every common illness, fever, weakness, headache, vomiting, diarrhea, cough, chest pain, body pain, tiredness. These are things people experience all the time in Nigeria, and most of the time from malaria or typhoid. So, and you are right, yes, because the problem is this is this is exactly why Lassa fever is difficult to diagnose early, and why so many cases are missed or misdiagnosed. So the early symptoms alone cannot tell you if it is Lassa fever, and you need a blood test to confirm. But there are some things that should raise your suspicion, particularly if you live in or have recently visited an area where someone in your household or community has been diagnosed with Lassa fever, or if the symptoms are not responding to treatment for malaria or typhoid. Now, I'm going to talk about when the sickness, like when the symptoms really get serious. So if people develop severe disease, the second week is when things start getting much worse, and this is where Lassa fever starts to show its real danger. In severe cases, the person may develop facial swelling. The face becomes noticeably puffy, like especially around the eyes and the neck. Yes, the eyes and the neck, like to just be looking, as if the person is just waking up from sleep, or the person had a fight. So those are the symptoms, like when the symptoms is really really serious. So there can be a pain and swelling in the neck. The person may have significant fluid build up in the lungs, causing breathing difficulty. The blood pressure can drop dangerously low, and then the heart rate becomes irregular. So one of the things that makes Lassa fever particularly notorious is bleeding. And in severe cases, the virus affects the body ability to clot blood properly. So this can cause bleeding from the gums, the nose, the eyes, the ears, or the digestive tract. So some people bleed under the skin, causing patches of bruising. In pregnant women, there can be bleeding from the womb, and this kind of bleeding is very serious and indicates that the disease has progressed to a critical stage. So neurological complications can also occur in severe cases. You see some patients develop encephalitis, inflammation of the brain, which can cause confusion, disorientation, seizures, and tremors. And when someone with Lassa fever starts showing signs of brain involvement, their prognosis becomes much more guarded. So deafness is very common complication of Lassa fever, and this one surprises many people. Yes, about 1 in 4 people survive severe Lassa fever experience some degree of hearing loss. Yes, they become deaf, and in many cases, this hearing loss is permanent. So it can affect one or both ears. It can range from mild hearing reduction to complete deafness. So, and it can happen even in people who did not seem to have a very severe illness. So it can affect people who would not even expect. So this is one of the most lasting and life-changing consequences of Lassa fever, and it is something that is not often talked about. So Lassa fever is also particularly dangerous in pregnancy. Pregnant women with Lassa fever have a higher risk of severe disease, miscarriage, preterm birth, and death. So the death rate among pregnant women with Lassa fever, especially in the third trimester, is significantly higher than in non-pregnant women and men. So the fetus is also at very high risk. In many cases, delivering the baby, even if premature, improves the mother chances of survival. So this is heartbreaking reality that healthcare workers dealing with Lassa fever in obstetric setting face. So it's not easy, like especially with the pregnant women. So that is why we all need to be careful. Always go to hospital, go for blood check, just to be sure. Especially when you are living in an environment where rats are all over. So these are the symptoms. Now, okay, everyone. So far, we have covered the history of Lassa fever, where it came from, how it was discovered in Nigeria in 1969. We talked about what Lassa fever actually is: a viral hemorrhagic fever caused by Lassa virus, carried by the multi-mammate rat and endemic in West Africa, including Nigeria. And then we went through how it spreads, primarily through contact with rats, urine, and droppings on food or surfaces, and through contact with the bodily fluids of an infected person. And we talked about the symptoms, from the early general symptoms that look like malaria or typhoid to the severe complications, including bleeding, brain involvement, hearing loss, and a very high risk if it possesses during pregnancy. So if you're just joining us now, welcome. We came in at a good time because we are about to get into the practical side of things, the stuff you can actually do, prevention, treatment, and what to do if you suspect Lassa fever, and why awareness matters. So while we are here, please share this live. If you've done so already, WhatsApp, you can share on your WhatsApp, your Instagram, whatever you are, just type share, share. Um, and also, you can also type sharing now in the comments. So if you're about to share it, every share could reach someone who needs this information. So, now I'm going to talk about how to protect yourself and your family from Lassa fever. So I personally get most excited about this because it's where you take control. Prevention is power, and with Lassa fever, so much of the prevention is our hand, literally in our hands, in our homes, and in our communities. So let me go through the key. Um, right now, I'm going to go through the key prevention measures one by one, and I want this to be practical, that you can go home today and start implementing them. Now, the rats, keep rats out of your home. Some people, they don't even care anymore. Like, they feel it's a normal. In fact, some of them is not part of their family itself. Like, you see them and rats, they're even doing competition in the home. So um, I'm going to talk about how to keep rats away from our home. This sounds simple, yes, but it is the most fundamental thing. And remember, the Lassa virus lives in rats. So if there are no rats in your home, the virus cannot get to you through that route. So the first priority is rat control. Start by looking at your home with fresh eyes. If there are cracks in your walls, gaps under doors, holes in the ceiling or roof, these are entry points for rats. Seal them. Use cement, wire mesh, or whatever material you have available to block entry points. Rats, because rats now, they can squeeze themselves through surprisingly like small spaces. So you just have to be very, very careful and observant when you're covering all those places. Also, keep your compound clean, because rats are attracted to wastes, especially food wastes. Make sure your rubbish is properly disposed of. Do not leave food waste. Do not leave your food waste lying around your compound, because rats thrive in dirty environment. So a clean environment is less attracted to them. And also use rat traps. This is old school method, but it works. Like it actually, it's really really works. So place traps in areas where you suspect rat activity, along walls, behind furniture, in the kitchen, in the store. Check and reset traps regularly. But remember, when you catch and dispose of a dead rat, do not handle it with bare hands. Use gloves or a thick plastic bag, but the dead rats can still carry the virus. Do not keep rats as pets. Some people, especially children, find baby rats and keep them as pets. This is a real risk, and is a real risk for Lassa fever and should be avoided completely. So do not keep rats as pets. And also store your food properly. Guys, I'm listening at the number two. Number one, I said how to prevent rats, how to chase rats away from your home. That was what I mentioned for number one. So number two is store your food properly. This is absolutely critical because most Lassa fever infections happen because of contaminated food. So protecting your food is protecting your life. So store all food, in containers that rats cannot get in, like metal containers, thick plastic containers with tight fitting lids, sealed bags. Do not leave food in open bags, open baskets, or and open surfaces overnight, especially not grain, rice, gari, beans, or other dry foods that are often stored in bulk. Always wash fruits and vegetables truly before eating them. So even if they look clean, you do not know what has been on them. Like I said earlier, I advise people to use salt to wash their fruits before eating. And then cover your pots and pans when not in use. Cover your water containers because rats can contaminate water sources too. And then do not eat food that rats have clearly been on. Yeah, there was a time I bought, like, you see, if you go to supermarkets, you see some like noodles, some packaged food and rat has already eaten it, and some person they'll just cut that part and remove, and then they will cook and eat. I don't advise that. So it's better you just throw it away and get a new one to eat. It's not advisable. So as long as rat has already eaten part of it, so it's not advisable to eat what rat has already eaten. Like I said, some people will just remove that part and say, after all, I'm Africa. Nothing will happen to me. It's just God that is protecting us, but you just have to be very very careful. So do not eat food, like I said, do not eat food that have clearly been on. I know food is precious and we do not want to waste it. So, but if you can see evidence that rats have been in your food droppings like bites, marks, urine trace, please do not eat that food because the risk is not worth it. Avoid eating smoked or dried rats. I know in some communities this is a traditional food source, but given the risks of Lassa fever, this practice needs to be reconsidered. So if you must handle rats for any reason, always use gloves and wash your hands truly afterwards. Now, number three is practice good hygiene. Wash your hands. Yes, wash your hand. Washing of hands regularly with soap and water. No, this is something we say for so many diseases, and we say it again for Lassa fever. Wash your hands regularly with soap and water, especially before eating, after using the toilet, after handling food, and after cleaning, because the virus can be on surfaces, counters, utensils, floors. So if a rat has passed over them, washing your hands removes it before it has a chance to enter your body. So if you're cleaning an area that has rat droppings, please do not dry sweep. I said this earlier and I want to say it again because it is so important. Dry sweeping to stop dry droppings and sends particles into the air where you can breathe them in. So instead, wet the area first. If you're sweeping, you just wet the area first. Spray it with a disinfectant solution or even just water, and then you clean, you sweep. because this stops the particles from becoming airborne. And use gloves and a mask if you can. And for number 4, protect yourself when caring for a sick person. So if someone in your home or community is seriously ill with a high fever and you do not know the cause, please be careful. Using like always be careful until you know what they have. Treat their bodily fluids as potentially infectious. Use gloves when helping them and avoid direct contact with their blood, urine, vomit, or sweat. Wash your hands truly after any contact. And the most important thing, get them to a hospital as quickly as possible. Do not wait to see if they get better on their own. So early medical attention is what saves lives with Lassa fever. And for number 5, be aware of your environment. So if you live in or are visiting an area where Lassa fever is known to be common, especially rural areas of Edo, Ondo, Ebonyi, Bauchi, Taraba, and other high burden states, be extra vigilant. Know the signs and symptoms. Know the nearest health facility that can treat Lassa fever. Keep your home as rat-free as possible. And if you develop a persistent fever with any of the symptoms we talked about, do not wait too long before seeking medical care. And for now going to talk about the treatment, how can be treated. So what happens? You see what happens if someone is being infected? What is the treatment for Lassa fever? So the most important thing to say is this: go to a hospital early. The earlier treatment starts, the better the outcome. Do not wait. Do not try to manage at home. Do not self-medicate. Because Lassa fever needs proper medical care. So there is an antiviral drug called ribavirin. Ribavirin, yes, that is used to treat Lassa fever. So when it is given early, especially within the first 6 days of illness, it has been shown to significantly reduce the severity of the disease and reduce the death rate. So this is really important because it means there is a treatment that works, but timing is everything. So the earlier ribavirin is started, the better it works. So in hospitalized patients, supportive care is also very important, and this means managing the fever, replacing fluids, correcting electrolyte imbalances, maintaining blood pressure, treating any complications that arise. Good supportive care saves lives, even when specific treatment is limited. So patients with confirmed or suspected Lassa fever are isolated in the hospital to prevent spreading the infection to other patients and to healthcare workers. So healthcare workers caring for Lassa fever patients use full potential protective equipment, gloves, gowns, masks, face shields, and so this is how we protect those on the front line. And there's currently no approved vaccine for Lassa fever. Research is ongoing and there are some vaccine candidates being tested, but as of today, there is no vaccine available for the general public. So this again makes prevention and early treatment for most powerful tools. For people who survive Lassa fever, follow-up care is important, especially checking for hearing loss, which, as I mentioned, can happen even after recovery. So if hearing loss is identified early, some interventions may help. And I want to talk for a few minutes about why awareness is not just nice to have, it is a life-saving. So think about this. A family is in a community where Lassa fever is present. So the father develops a fever, weakness, and sore throat. Nobody in the family knows about Lassa fever. They assume it is malaria. They buy malaria medication from a chemist. The fever does not go away, and after a week, the man is much worse. His wife is now also developing symptoms because she has been caring for him without protection. He finally go to a hospital, but by now the disease has progressed significantly, so the outcome is not good. Now imagine the same scenario, but the family has attended a health talk. The wife has been a video. I've seen a video on social media about Lassa fever, where the husband developed his fevers, and it does not respond to malaria treatment. Something clicks. She remembers they have been having a rat problem in their kitchen. She takes him to the hospital immediately and tells the doctor she suspects Lassa fever. The doctor orders the right test. Treatment starts early. The husband recovers. The wife, because she knew to protect herself while caring for him, she's not infected. So some diseases completely different outcome because of awareness. So this is why we do this. This is why every Thursday at 3 p.m. I show up here, and also this is why Do Take Action goes into communities and schools and hold outreach sections, because information changes outcomes. Knowledge saves lives. So every person watching this today is now equipped to protect themselves and their family from Lassa fever. But you're also equipped to protect your community, share what you know, tell your neighbors about rat control, remind your family to store food properly, tell the young people in your community what the signs are, because every conversation you have about Lassa fever is a life potentially saved. So before we close, I want to give you some very specific thing to do after this section. The first thing is to share this video right now. Um, when we finish, share it on WhatsApp, share it on Instagram, post it in your family group. The more people who watch this, the more communities are protected. And the second thing is to go to homes and do a rat check. Look at your home. Are there gaps in your walls? Do not use rat droppings anywhere. Is your food properly stored? Make the changes that need to be made today, not tomorrow, but today. And then the third is to register as a GDC. We do take action, and if you have not already, you've already done so, become a grassroots development champion under good health and well-being, because you now have the knowledge, and the next step is to use it to go into your community and share it to be part of the solution. That is what GDC is about, and we need more people like you. And so the fourth thing is to know your nearest health facility. Find out which hospital in your area can treat Lassa fever. Put the number down on your phone so that know where to go if you ever need it. And also the NCDC has a that you can call for health information and guidance in Nigeria. So please, all this I've mentioned, please remember to just do everything I mentioned right now. Okay, so everyone, we have reached the end of today's section, and I just want to take a moment to say thank you from the bottom of my heart. We talked about everything today. We covered the history of Lassa fever and how it was discovered right here in Nigeria in 1969. We talk about what it is, a viral hemorrhagic fever caused by a virus carried by rats. We broke down all the ways it spreads from rats to humans through food and contact, and from human to human through bodily fluids. So we went through all the symptoms, from the early fever and weakness that can look like malaria to the serious complications like bleeding, brain involvement, hearing loss, and the very high risks during pregnancy. We also talk about what to do to prevent it, to prevent rat control, like food storage, hygiene, and protecting yourself when caring for the sick. And we talked about treatment, the importance of going to hospital early, the antiviral drug ribavirin, and why early action saves lives. So you came in today knowing very little or nothing about Lassa fever. You are living today knowing enough to protect yourself, your family, and your community, and that is powerful. Remember, Lassa fever is preventable, it is treatable when caught early, and awareness is the first line of defense. Do not let fear be louder than knowledge, and let us knowledge be louder than fear. So thank you so much for spending your Thursday with me. I love doing this for you, and I will see you again next Thursday at 3 p.m. for another powerful section. God bless you. Stay safe, stay healthy, and please share this video before you close it. Bye, everyone.